Happy Friday, everybody, and welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, I'm going to tell you what I think is the biggest risk of having plastic surgery. And then, measles, it's making a comeback. What do you need to know about it? I'm going to tell you. And then finally, we're going to get philosophical. Philosophical is what we're going to do. And we're going to talk about dating someone with a boyfriend or girlfriend, right or wrong. It's all coming up right now.
This is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Hit that like and subscribe button. Turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me back again is Sarah.
Hi.
We missed you, Sarah. It's been a few weeks.
It's been a while.
It's been a while, but we're back. The gang's all here. In the box, we got Travis. What's up, man?
Hey, how's it going?
It's going good. Happy Friday to you, sir.
Happy Friday to y'all as well.
Yeah. All right. You guys fall in the NCAA tournament?
No.
Kinda. I know Texas Tech is still in it.
Okay. That was the one team that I was going to ask. They are still in it.
Yeah.
Do you have ties to Tech?
We have a few interns that used to actually intern here that go to Texas Tech.
Really? Okay. So I went to med school at Tech.
Oh, really?
Yeah, and I always liked Tech. You know, I grew up here in Texas, and so I followed college football, and I was kind of like Texas
You went
Tech.
to Louisville too, didn't you?
I did for general surgery.
Okay, right
Yeah,
on.
that's right. Yeah, general surgery. Yeah,
right on.
I did my undergrad at Baylor, and then I did med school at Tech. So
Okay.
I like Tech. You know, I used to go to all the football games when I was out there at med school. You ever see them throw the tortillas?
No.
Oh, you haven't seen that?
No.
Maybe they don't do that anymore.
I don't watch enough college sports.
Oh, okay.
Yeah,
All right. Yeah.
I just know that they're in
So
it.
at the football games, like at every kickoff, you would throw tortillas on the field. I don't know why.
Out of all the foods, why tortillas?
Because they fly really well.
That makes sense, okay.
They fly nicely. Like you can really whip a tortilla, and so you would bring in these bags and like a kickoff, and it's just like it's like at graduation when people throw their hats, except it's tortillas, and then they're like raining down on the field.
Oh my gosh.
College
They
kids.
probably
no
quit
idea.
doing it because it probably, I guess, probably got to be a hazard with the slip on a tortilla out there, break an ankle, your career's over.
Probably a bunch of bloated birds flying
Yeah,
around
that's
too.
what I was thinking of too. Thinking the same thing.
Rat problem.
Oh man, but yeah, Texas Tech. I hope they win it. They're pretty good, right, this year?
I believe so. I think number one, Florida, is who they play next.
Oh,
So
wow, I'm gonna have to watch that.
Yeah.
I usually make a bracket because I'm a degenerate gambler, and I don't know anything about basketball, but I like to make a bracket because but I forgot to make one this year.
I
So-
didn't.
Huh?
I said I didn't make one.
Do you
I didn't
normally
forget
make
either.
one?
No.
Yeah. My wife and I made
I don't watch
one
it.
a year before last, and she ended up either winning or coming in second and won like a couple $100.
Oh, that's dope.
Yeah, it was cool. I don't know anything about that. I'm literally picking teams like I like their mascot. I used to go to this school.
I know somebody who went to that
I know somebody
school.
that went to this school.
No, we got a coworker of mine. He said that he literally picked his bracket based off of vibes.
A vibe? Yeah. Oh, that's totally what my wife does. She's like, "What's the mascot for this one? Blue Devils. That sounds pretty cool."
Yeah, that's funny.
Yeah, pretty good stuff. All right, let's roll into some segments. I think we got some pretty good ones today. The last one you guys are gonna have to weigh in on because it's not medical, and so I need some like real opinions. But before we get to that, we do have some medical stuff. So we've done a lot of segments on bad outcomes on this show and complications, and mostly related to plastic surgery. And I think it's good to learn about these things. Of course, I always say we're not trying to sensationalize bad outcomes, but we try to learn from them and help people avoid making mistakes that might lead to the same outcomes. But those really bad outcomes where people die or like have all these really terrible things happen to them are really not that common. We talk about them because they make the news, but really they're not the biggest kind of threat or risk of having plastic surgery. So I'm gonna ask you guys, and there's no right or wrong answer to this because this is purely opinion, but you guys have been on this show a long time, and what do you think? What do you think your biggest risk is going to have plastic surgery?
Biggest risk?
Yeah, what's the biggest
Infection?
Yeah, so I mean that's the obvious answer is infection, and that's always a risk. But historically those are pretty low. I mean there are some plastic surgeries, like especially breast reconstruction, that carries a fairly high risk of infection because just doing a mastectomy is so traumatizing to the area, and then they make it radiation, and then you're trying to do these really complex surgeries, and yeah, infection is a real risk. But I was thinking more like just somebody wants to go get liposuction or breast aug or whatever. I don't know, Trey, anything? I mean, there's no right or wrong answer here, man. Like,
really, the only one is like a weird one. Like when surgeons leave like utensils.
Oh,
in people.
utensils in, yeah.
Yeah.
Yeah, fortunately, it doesn't happen too often.
Yeah.
I've actually...
The only one I would say would be like a surgeon error.
Surgeon error. Okay, well, that's kind of getting along the lines that I'm thinking. Okay, so this segment actually... So I always, come up with these segments either from looking at news articles or... like patient interactions, and this came from both. Like I saw this news article 2 days ago, and then I had a patient interaction yesterday, and I was like, okay, I'm gonna do a segment on this. So let me throw up, so this is a segment about, I'm gonna reveal what I think the biggest risk of plastic surgery is. And the article that I saw this on, throw that article up, it says this actress, Chopra, I think she may be an actress in India, to be honest. And this article was talking about how her daughter went to have plastic surgery, and she went in thinking she was going to get something and came out with something totally different. And it kind of leads into what I think really is the biggest risk if you go have plastic surgery, is that the outcome that you get is not what you wanted or not what you expected. And there's actually some data to support that. I pulled one article, throw that, if anyone wants to look at this. This is basically just looking at, how many people are satisfied with their plastic surgery. And there's several of these studies, and the range of people who are unhappy, it hovers between 10 and 20% in most studies. I think this one was like 14%. So 86% of people are happy, but 14% of people are not. And so, like purely looking at statistics, infection, Sarah, which is a very common answer, but in reality, with the kind of advances in technology and surgery, for elective stuff, the infection rates have plummeted. Like, I quote people a less than 1% risk, with reconstruction being the one potential, outlier in that. Things like bleeding, which is other common, is also like 1% or less. Some surgeries have, a little bit higher risk. You talk about things like breast augmentation has a risk of scarring, the contracture. That's, nationally like 10%. Most good surgeons have a lot less, like we do. But, you look at number of people who are unhappy. Okay, so that's 15% on average. That's a pretty high number. And, when it comes to plastic surgery, like having people be unhappy, in my opinion, is something that is almost completely avoidable. I had a patient come in just recently, yesterday, I think, and, she came in and she wanted to do implants and she wanted to do a lift. And, if I'd just taken her on face value and said, okay, we're going to do implants, we're going to do a lift, I mean, she would have been all for that. But after I started talking to her about what she really wanted, and without, getting too much detail, she really didn't want an implant. She just thought that she did because she thought that the outcome from that would give her what she wanted, when in reality, she just needed to have her breasts lifted. And after talking to her for quite some time, I quickly came to the conclusion that you don't need an implant. Like, what you want can be done by just doing one surgery. And so, when you tell people that, when they come in and wanting something and you're trying to change their mind, you are basically putting at risk them having surgery with you, because some people get in their heads that they want one thing. And also too, I'm talking her out of money. And so I don't think everyone necessarily would do what I did, which is to try to convince her that she didn't want what she was coming in for. And so, I think if she'd gone to other places, that she very well could have ended up with implants and a lift. And I think I'm certain that she would have been unhappy, if not immediately, down the road.
Right.
So how does this happen, right? So how does a patient, get an expectation that they don't want? So, Sarah, I know you've been very open about the fact that you've had surgery in the past. Like when you went and talked to your surgeon, Do you feel like they first off, did you talk to the surgeon?
Uh-huh.
You did? Okay, that's great. That doesn't always happen. And so good, that's great. But do you feel like they really listened to like what you were wanting for an outcome? Did they spend the time to say, okay, what is it that you're looking for? Or did they just say, oh, you want the surgery, we're gonna do it?
I mean, I feel like it was forever ago.
Oh, sorry. I didn't mean to put you on the spot. I know we've talked, so for everyone out there, Sarah's pretty open about this, so I'm not like.
Yeah, no,
Okay.
I don't mind. It was forever ago, I feel like, but I remember him just, plainly asking me, what is it that you want to see happen?
Okay, I love that. That's
and
good.
he asked like what size I wanted, and then he also at the end of like all of that told me what he would like pretty much allow himself to do. Like saying
Okay.
like this is what I can do for you.
This is my guidelines.
Yeah, so that's when he told me that
That's very good.
if I wanted to look natural, that this would be the cup size. If I, since I was like very petite and muscular, that he was like, if you put it on the outside of your muscle, it's going to look really weird. So we're not doing that. It has to go under.
Okay.
And stuff like that. He was very like,
So very thorough.
and straightforward. He wasn't
Okay,
like,
I love that.
Yeah.
You have your surgery in Texas? I can't remember.
Georgia.
Georgia, okay. Well, hats off to your surgeon because...
He's been doing it for a while. He's an old man.
Was he good? Sometimes that's good. Most of the time that's good. Every once in a while people...
And like I've said it before on this show, like he reminded me of Mrs. Doubtfire. He had that accent, like Irish accent or Scottish.
Oh, really?
Yeah.
Interesting. Well, hats off to him because all of the things that he did, I think, are very important to actually talk to a patient and really kind of dive into what is your expectation and what can be done and setting guidelines for what's possible. So going back to how does this happen? How are 15% of people unhappy with their results? And so I started listing out some things that I think are potential issues where someone may not get the outcome they want. So I think number one is if the doctor expectation of a result and the patient expectation of a result don't mesh. And so the common way that I kind of elaborate this to make it easy to understand is, say a patient comes to me and they say, okay, I want an augmentation, I want to be a D cup. And I say, okay, I'll make you a D cup. I mean, how do you know that that patient's vision of a D cup and mine are the same? Because, Trey may not know this, I know it just 'cause I'm in the biz, but when it comes to bra sizes, they are a little bit arbitrary.
Yeah.
And a D cup in one brand may not fit you, with a different brand. And so, I think you have to go into a deeper dive than that, but I know that happens where it's not clearly stated that the expectations are the same.
Right.
I think if you don't spend enough time with patients, it sounds like your doctor did a very good job of taking the time to listen to you and then give feedback, and that doesn't always happen. There's a lot of places that patients can go where it's just like a patient mill, and maybe you see the doctor, maybe you don't, or maybe and I've worked with I had the opportunity to work with a lot of plastic surgeons over my career during training because I did 2 different fellowships, and there were people I worked with that I really liked, and there were people that just kind of came in and said, oh, you want to have the surgery done? All right, see you next week. And I didn't like that at all. I thought that was just not, it wasn't thorough enough.
Yeah, it sounds like a mill.
It sounds like a mill, right?
Yeah.
It could come from just poor doctor-patient relationship. I've also said on this show before that having a good doctor-patient relationship is critical to having good outcomes.
Yeah.
And so, maybe the doctor just sucks at doing consults. I mean, I've worked with people that I think that just
Sometimes doctors don't
They're
have
just not
very
people.
good bedside manner.
Yeah, they don't have good, EQ or emotional quotient, or are not good at talking to people, or maybe they feel uncomfortable.
Yeah.
If the doctor doesn't do the consult, I mean, that does happen. I know that there's places here in Dallas that if you go for a consult, you see the nurse, and they're the ones doing the consult, which I'm very much against that. Medical tourism is another big one.
Right.
If you go for medical tourism, it's going to be a bad doctor-patient relationship. It's almost a guarantee. And the other one being the patient's not open to change. That kind of is something I was bumping up against yesterday. Unfortunately, the patient was totally cool, and she's like, well, thank you. When you explain it in that, yes, I'm telling you that maybe you want something different, but in doing so, I'm, saying that you're paying half the money.
Right.
I think patients respect that. The other way that you can get an outcome is if the surgery, if a surgery has unexpected results and that's not clearly defined. And the classic one, again, given an example, is, and a lot of people don't realize this, but if you get liposuction, yeah, you're going to suck out the fat, but the one downside to liposuction is it makes your skin loose. And so I'm doing consults for liposuction. I say that very, very clearly. Look, this will absolutely decrease the fat, but just like if you went and lost weight on your own, like your skin's going to be a little bit loose, and you just need to be aware of that.
Yeah.
And so if that's not explained, then you can have an instance where a patient goes through it and then they're unhappy. The other one that also has unexpected results is if implants are too heavy. People get really big implants and suddenly they start to have the symptoms like people have when they need a breast reduction. Yeah. Neck pain, back pain. And then finally, unrealistic expectations. There are patients that, come in, and I've had people say things like, well, I don't want to do it if it's going to be perfect. And that always freaks me out because perfect is very subjective.
Well, that's I feel like that's the vibe plastic surgery gives off. For me,
perfection.
the word plastic is very perfect.
Yeah.
So.
There are people I think out there that have that expectation, but for me, I say it very clearly when I do a consult. It's obviously the goal is to make it look perfect, but one, not everybody can get a perfect result, because they don't have the right starting point.
Yeah.
And then two, perfect is subjective. I mean, you may look at something and say that's perfect. I may look at it and be like, eh.
I feel like if a person looks perfect, though, to me that
it's
looks weird.
Unnatural. Yeah, right.
You're not supposed to look perfect.
I saw an article. I almost did a segment on it. There's some article about the perfect appearing woman that spent $1 million on surgery, and I looked at it and I was like, that's not look perfect to me.
Yeah, she looked weird.
That looks like not perfect.
Something's off.
So I think that, if you want to avoid having plastic surgery and avoid having an outcome that you didn't expect, I think there are some ways you can do that. I think number one is having a great doctor-patient relationship. If you're going to go have plastic surgery, you should really feel like you vibe with the surgeon.
I feel like you can talk to them.
You can talk to them, they listen to you, they ask you questions, that's a good doctor-patient relationship. Doing a thorough consult, which also goes along with good doctor-patient relationship.
I actually brought my friends with me whenever I
Did you?
went to my consultation.
I think that's good. I don't dislike that at all when people bring...
They ask questions too.
Yeah, I know.
It's funny.
It's great. I think it's great when patients ask questions because it means that they're involved with their own care.
Yeah.
And even if a friend is a proxy for that, I do think that that's helpful.
Yeah.
Avoiding medical tourism, I've said that 100 times on the show. Medical tourism is not good.
No.
It's just not. There's just so many potential pitfalls for that.
Risky business.
If a doctor is not willing to say no or disagree. I mean, you can sometimes get into that when people are desperate. I remember when I first started my practice and you're just struggling to survive and you really don't want to have patients be turned away.
I can imagine having high-end patients, when you start getting into that bracket.
Yeah.
It's how do you tell this person
Yeah,
that?
how do you tell Madonna, no, I'm not giving you more
Yeah.
lip filler because it's Madonna. You just have to do it. I mean, you just have to be like, nope.
I'm going to lose my license, but yes, here's more lip filler.
Yeah, here you go. And lastly, the patients need to be willing to change their mind.
Yeah.
If somebody makes a good case for this is not a good idea, then they have to be willing to listen to that.
Yeah.
So, but yeah, I mean, the data is pretty clear that you can look at risks and complication rates and you can pull the data on that. And really, if you consider this a risk or complication, the biggest risk is that your outcome is not what you wanted, you're not happy with it. And so I think that there's definitely ways to avoid that as we laid out. So, all right, let's recap this one real quick, Trey. So today, I, as a plastic surgeon, was revealing what I thought is the biggest risk of plastic surgery. And some might think it'd be infection or bleeding, but it's really not. If you look at the data on it, one of the biggest risks is that if you go through plastic surgery, you may not like your results. And the data on that ranges from 10 to 20%. So, around 15% of people that have plastic surgery don't like it. So How does this happen? Well, it can happen if there's not a good doctor-patient relationship, if the doctor doesn't take time to listen to you, if you do things like medical tourism where the doctor-patient relationship suffers, if patients aren't willing to take advice of doctors. There's a lot of ways that you can end up with an outcome that you didn't expect. It is critical that if you're going to have plastic surgery, that your expectation of outcome and the doctor's expectation of outcome are the same. And that takes time, it takes talking to patients, having a good doctor-patient relationship. And if you do all those things, then you're going to be in that group of people that are happy with your plastic surgery. So there you go. Cool, moving on.
Good info.
I think that's a good one. I like that topic. I mean, it's good if you're thinking about having plastic surgery to, know these things.
Yeah.
I think. I don't know. What do I know?
I don't know. You're just a plastic surgeon.
I just plastic. Okay, what do you know about measles?
I know that there's people getting it. There's like a person that has died in Texas from it.
There was one, yeah. I heard there was one, yeah. Do you know anything about measles?
I know that it was eradicated and that there was a vaccine for it.
You knew it was eradicated?
Yes.
Okay, that's very good. I don't think did you know, Trey, that measles was declared eradicated?
I did not know that.
Yeah, I mean, honestly, I didn't remember that. I think when I saw it, I was like, oh, right, they did say that was.
I think I learned it in epidemiology.
Yeah, you have that medical background. I keep forgetting. So anyway, we today are going to do a segment on what you need to know about measles because it is kind of making a little bit of a comeback. And I think that the reason this segment is important because measles was eradicated. And when that happened, it's like everyone forgot about it, and now there's a whole generation that's gone by with people.
When was the last generation that got the vaccine? Don't remember.
Like the last generation? I mean, people are still getting the vaccines.
Like, is it mandatory?
Oh, I don't think it's mandatory. No.
Like, did I
It's
get
like
it? I don't
strongly
remember.
suggested.
I don't remember if I got the vaccine or.
Oh, I'm sure you did. I'm sure you did.
I wonder if Avery did.
I'm sure she did. Very
so like
few.
everybody gets vaccines for it though. Like,
Yes, it's the MMR.
Yeah.
Measles,
okay.
mumps, rubella.
There you go.
Yeah.
My mom was a nurse and she was like always talking
Yeah.
about that. But isn't there a vaccine that like you don't have to get anymore because it's like gone? Like the one that like tears up your arm.
Like polio?
Maybe.
Smallpox.
Yes.
Is there a smallpox vaccine?
Something
There
like
is,
that.
right?
They're like they only
There
give
is
it
a
to like
smallpox.
the military now.
Yes,
And
I
it's
think it's
like
smallpox,
the big
yeah.
scar. Like my mom has one.
Yeah.
Yeah.
I think you're right. Yeah.
Okay, that's what I was thinking.
So-
that's the wrong one.
As you guys probably have heard, in the past couple of years, the U.S. has seen a pretty notable increase in measles outbreaks, despite, as Sarah said, the disease being declared eliminated in the United States in 2000 was when that happened. So I want to do a very neutral thing about measles. This isn't a, beat people over the head about, going out and getting vaccines, although we are going to talk about the vaccine. But I just want to really talk about measles because
Yeah.
I don't think everyone knows about it because it's kind of fell out of our memory. Because it did get eradicated. So it is a highly contagious viral disease that's caused by the measles virus, rubeola. It spreads through the air, so like coughing, sneezing, interactions like that. And what makes this disease really kind of dangerous is how insanely infectious it is. And there is a marker for how infectious the disease is. We've talked about it a couple times in the past. It's called R0. So it's like an R with like a little 0 at the foot of it.
Okay.
Yeah, you probably have seen it like in your epidemiology stuff. It's R0. So the higher the R0, the more infectious something is. And what R0 really means is if, say you have a disease and everyone around you is unvaccinated for that disease, on average, how many people will you infect on average? And so if it's 2 on average, then the R0's 2, okay?
Okay.
So what does all that mean? So the flu, so influenza, R0 is 1.3, which
Okay.
means that if somebody has the flu and they're around a bunch of unvaccinated people, on average, 1.3 people will get the flu. COVID, which just, we talked about that for many years. The R0 for that is in between 2 and 8, depending on the variant.
Okay.
And that's why we actually talked about that on one segment, I think many years ago now, about how COVID was much more infectious than the flu. And it is. The R0 is higher. It's easier to transmit. Measles, R0, 12 to 18.
Yikes.
So on average, if one person has measles and they're around other people that are unvaccinated, that one person will infect 12 to 18 people, which then think about if everyone's unvaccinated, those 12 to 18 people will each one of them will also infect 12 to 18 people. And that's what makes measles, more dangerous. I managed to go most of my life without ever getting the flu until this year without taking the flu vaccine. Why? Well, one, I'm pretty good about washing my hands and avoiding situations where I'm exposed. But two, it's actually not super easy to catch the flu compared to other things. But measles is completely different. So what happens when you get measles? So it takes about 1 to 2 weeks or 7 to 14 days before the symptoms start. Symptoms are very high fever, cough, runny nose, and the distinctive rash of measles. I took another pic, Trey, throw that pic up there, yeah. Measles rash, pretty distinct. It's different than the chickenpox. Chickenpox makes little vesicles, which are almost like little blisters. This is more of a rash type. The problem with measles, outside of being very infectious, is it can cause some serious complications. The most dangerous is pneumonia, that's what's the number one cause of death if people die from measles. Encephalitis, which is infection of the lining of the brain, blindness, and deafness. Now, how common is serious complications? Well, if 100 people get measles, 90 of them, or 90%, are going to have a very safe resolution of the measles. Like, they'll be sick, but they're not going to get serious complications. But 10% do get serious complications. So that's not a super low number. It's not bad, but it's also not great. The most at-risk people for serious complications are young kids, pregnant women, and those who have weak immune systems.
Yeah.
Unfortunately, there's not really a good treatment for the measles. Like other viral diseases, if you get it, the treatment is really symptomatic. Like, you treat the symptoms. There's no good antiviral for measles. So if you get it, you have to ride it out. Unfortunately, the number of people that die from measles is not high, like being very fair, because, there's a lot of scare going on about, measles may come back. I mean, it is notable, it's significant, but, back when measles, prior to the vaccines, millions of people got the measles every year, and the death rates were like 500 to 1,000. So, you can calculate that out to be, it's really a tiny fraction of 1%. Now, that doesn't include the people that had serious complications that may have given them other problems, but purely death rate is actually fairly low. So a little bit of history on this. The vaccine came out in 1963, and prior to that, there were millions of cases per year. The vaccine that came out in 1963 was a game changer. It has 90% effective rate at preventing transmission, which is pretty solid. Like, that's really, really, really good. The other vaccines don't carry that high of an effective rate, especially something like the flu, which ranges from 10 to 50% effective. Like, 97% is really, really solid. So as you correctly stated, in 2000 it was declared eliminated in the United States, and then in the 2010s to today it's made a little bit of resurgence. But to be fair, resurgence is not millions of cases. I looked at year to year. I think the highest year was 2019 maybe. I can't remember now. But the highest year was 1,200 cases.
Oh, okay.
So, you're not talking like thousands and thousands. And in some years, it's only a few hundred.
Did they talk about, like, what percentage of them were vaccinated?
None. Practically none. Yeah. I didn't look at the data on that, but I've looked in the past. And, yeah, the people getting measles nowadays are almost entirely unvaccinated. And
it's like, I feel like that's like that trend for not vaccinating your kids.
Yeah, so there's been, as we've talked about this before, there's been some vaccine fatigue, from the pandemic, and I think that is bleeding over into other vaccines, which I think are very, very effective. I quit taking COVID vaccines after a while, as I've talked about before. I'm pretty neutral about vaccines. I said I've never taken a flu vaccine ever, and I always said if I ever got the flu, I was going to start taking the vaccine. And I got the flu this year, so next year I'm going to take it, and I'll probably get the flu again. but I'm sticking to my word. I said I would take it. I'm going to take it. But yeah, I mean, falling vaccination rates is one thing. For sure, if less people get the vaccine, then it is possible. Now, herd immunity is a real thing. I'm sure you guys have heard of herd immunity, meaning not every single person has to be vaccinated to keep a disease in check, because the disease has to have enough people to transmit it.
Spread, yeah.
So you have 98 out of 100 people are vaccinated, then probably the disease is not going to be around. But you do have these clusters of people who don't vaccinate. So some like religious groups, you know, where like the Amish, I think, don't vaccinate. I can't remember. They may. I don't know. Don't hold me to that. But there are religious groups that don't do vaccinations, and so you get these clusters of unvaccinated people, and then that's kind of where these outbreaks happen. So. Yeah, I mean, and so obviously the next question is, okay, how do you prevent this? Well, I mean, not to be, you know, like the broken record for, you know, the medical community, but I mean, this is one where the vaccines are insanely effective, and there's no real research out there to show that there's like really significant downsides. I mean, every vaccine carries some risks of things like, you know, allergies and that, but in all, the vaccines for this one in particular are very good. Effective rates are good. Safety profile is good.
Yeah, it's been around for forever.
Yeah, it's been around for 60 years.
Yeah.
You know, I mean, it literally eradicated measles. I mean, it's hard to say that it's, you know, bad when it literally eradicated the disease that it was designed to protect from. So, but yeah, I think, you know, it's good to know about measles. I mean, I don't think measles is going to make some big comeback because, you know, the number of people out there that aren't vaccinated is pretty low.
Yeah, it is.
And so, you know, there's going to be these little outbreaks. And, you know, the one kind of philosophical thing is it puts people a little bit at risk if they can't get vaccinated. There are people who can't take vaccines, so those people would be at risk. But all right, let's recap this real quick, Trey. Today, we were talking about measles making a comeback. Measles was eradicated, as Sarah pointed out, in 2000. That was due to the vaccines that came out in 1963. But there's been a little bit of vaccine fatigue, less people getting vaccinated. There's also clusters of people who don't take vaccines for religious reasons. And so in the past 10 years or so, we've seen a little bit of a comeback, not the millions and millions of cases that were happening prior to 1963, but more on caseloads of hundreds. I think the biggest year was like 1,200. So we just recapped that measles is a viral disease caused by rubeola. It gives symptoms of high fevers, cough, runny nose, and the distinctive red rash that goes with measles. Now, the one thing about measles that's pretty crazy is how infectious it is. R0 is a measure of how infectious the disease is, meaning how many people will get the disease if you get it and they're not vaccinated. Things like flu is 1.3, COVID's 2 to 8, measles is 12 to 18, which means it is very, very infectious. It can have complications such as pneumonia, which is the one that can cause death, encephalitis, blindness, deafness. 90% of people get it do have a very easy course though, but 10% have complications which can require hospitalizations and in rare cases cause death. So I don't think measles is going to make a huge comeback because there's a ton of people out there that are vaccinated, but just be aware. It's out there. Just remember what it is, and we'll keep an eye on it. All right,
Yay.
Last topic. All right, you guys are going to weigh in on this one. This is off topic for us, but it kind of goes into lifestyle.
Yeah.
And so it was interesting. I got this off of a X post. Remember the Whatever podcast? I've talked about them before. So this is a segment about if dating someone that's taken with a boyfriend or girlfriend, right or wrong. And I'm going to get you guys' opinion. So I did get this from an X post by Whatever. Throw up the X post if anybody wants to track it down. It's that, and there's a video there, and basically they're asking women if they think this is okay, and then play that little video that's going.
Hot take, but it is 100% okay for you to go for a man that has a girlfriend. Hot take, but it is 100% okay for you to go for a man that has a girlfriend.
All right, first impressions, you guys. What do you think? I'm putting you on the spot here.
I don't know. I would never do that.
You wouldn't do it?
No.
You wouldn't like go after someone that had a boyfriend, girlfriend?
I would not pursue a man that had a
What about the other way around?
I would not
So you're out.
entertain it.
You would not entertain it.
No, because I mean, if I was at, say I worked in an office building and some man kept like flirting with me and I found myself being like, I like this, I would probably break up with the boyfriend.
So you would just end it.
Yeah, I would just be like,
Okay,
I'm
so you
gonna
would
do
entertain
something
it.
bad.
You would entertain the idea, but you probably would end the other one first.
sure, but I wouldn't.
Sure.
I wouldn't like.
Sure.
I don't know.
All right, Trey, weigh in, buddy.
Honestly, I think people hop on social media and just say stuff for clicks at this point. No, I wouldn't entertain it.
You would not entertain
I
it?
wouldn't go after another girl because I go by the old saying of how you get them is how you lose them.
Yeah,
right?
for real.
So it's one of those things to where like I feel like if I got her in that way, somebody else would get her from me in that exact same way. You know what I mean? So, like,
I mean, that is probably the biggest argument against it. I mean, I was gonna
I
point
couldn't
that.
trust her. Like, I honestly couldn't trust her.
And have you guys like ever? So obviously, you guys have not been in that situation ever in your lives.
I've
been in-
had people take
Wait,
it
yeah?
from me. Yeah.
So I've been in a situation in the sense of like, okay, somebody I'm talking to, I think they have somebody else, and then they're like lying. You see what I'm saying? So like they do have like a boyfriend. I didn't know it going into it.
Oh,
but then once we
they didn't say it.
Yeah, right. Once we got to talk, like I've talked to a woman before, and
did you just, that was it? You were done, or did you like, well, we'll see how it goes?
okay, so I've talked to a woman before that was married. And
Oh, see, that's like a different level.
but I
you didn't know. You didn't
Yeah,
know. You
I didn't know.
Okay.
Once I did find out she explained it, I did continue to talk to her.
And I do think that that's like a bar too far.
Sure.
I mean, like, because okay, I'm gonna go on and just say flat out, like, all's fair in love and war.
Sure.
I have zero problem with this.
Yeah.
And I'll tell you my experience with it actually, but I think with the marriage thing, I mean, then it just gets too messy. I mean,
Yeah.
that gets super messy, and so I'm gonna lower the bar down to like, you know,
Sure.
just boyfriend, girlfriend.
When I found out, she said they were separated. So I found out, and then she was like, "Well, we are separated and going our separate ways." And then they did like later on get like a divorce. But
Okay.
it was weird.
Yeah, that seems like too much.
Yeah, sure.
Well, would it matter to you, like, Sarah, because you're like, so Trey, I think, is like, he's on the fence on this. Sarah seems like she's a no. Would it matter about the strength of their relationship? What if they had been boyfriend, girlfriend for a month? Does that make a difference versus if they'd been together years?
Sure.
Oh, it does make a difference.
Sure.
So you'd
Yeah.
be more willing to entertain it if they'd only been together a short time?
I guess, but I feel like if I had so I do have a boyfriend, but like I would never do that to him, or
Right.
like if I'm thinking about like my situation right now, I would never do that. But
Yeah.
like I don't know, like maybe like 4 years ago, if I was talking or like I just became official with a
Right.
boy within a month,
So-
and then I found some other guy that potentially would be better for me or better for
Yeah.
my daughter, I would have been like, if I'm thinking that, then the relationship I'm in with this
Right.
boy number
Should
one
end.
Well, and you know,
needs to end.
and that's one of the kind of the pros to this, I think, like you can make a case for it, is that, I mean, I do think people get into relationships and it gets static and it gets comfortable and it's like, you know, it's the devil you know, right? And so, I'm sure you guys have probably either been in this type of relationship or had friends that, you know, they're in a relationship and you probably know it's just not gonna like end up being, you know, your forever, but you're just kind of in it because it's routine.
Yeah.
I mean, I do think that does happen. All right, I got more questions for you guys. This is good. So, I guess none of you guys would be the pursuer in this, right? Like say you meet this person, you're like, I really like this person, but they have a boyfriend or girlfriend. Like, say you're both single. I can't remember, Trey. You are single right now, right? Oh yeah, I missed you.
Yes, I'm
Yeah.
single.
All right. Well, say we're both single. It's like,
Would I pursue somebody that I knew had a girlfriend?
yeah,
Basically,
yeah.
no.
No, you would not.
I was actually in this situation probably like last week.
Really?
The funniest thing, yeah,
Yeah.
last week. So there was this girl that I was talking to. She ended up getting into a relationship with somebody else, so I backed off.
Okay.
Yeah.
All right. So, you know, what are the kind of downsides of this? I mean, one, Sarah mentioned it. I think you both did. Obvious concern is like, okay, well, if this person's willing to like step outside, how do you know they're not going to do that
Right.
to you? I mean, that is a concern.
Yeah.
I mean, that's a legit concern. But as I said, you know, people do get complacent in relationships, and maybe they're looking for a way out. You know, I mean, that could happen. I mean, I think that's a valid kind of criticism of it. But honestly, I think, and I tell you from personal experience, like probably to me the biggest thing is like the emotional toll of it.
Yeah.
Like it is emotionally exhausting to be in kind of, I mean, it's hard enough to date people. You throw in the mix of like someone's, you know, has a significant other. I mean, it can like really kind of affect your mental health.
Whenever I was using that, like the apps, it was exhausting.
The apps sound totally exhausting.
I was just talking to these dudes. I wasn't like going on dates with them. I was just talking to them, and it was exhausting. It was annoying.
Yeah. Yeah. So
I don't know how
I personally
anybody
like
can
kind
be,
of
like,
okay with this
two-term
whole
friend.
idea, but then it's like the idea of a dating app's too far for me. That just sounds like that sounds like that sounds like torture.
Yeah, I can see that.
But yeah, so I have experience with that. I remember when I was actually in college, there was a girl I worked with. I knew she had a boyfriend, and I tried all summer to get her to like go out with me, and it was weird because I guess she was just taken aback by my boldness. I was just like, I know you have a boyfriend, but like let's just go on one.
Probably just thought it was cute and funny.
Well, yeah, but I was like, let's just go out on one date. Like, it's just one date. I mean, there's no harm in that. Just come hang out. Maybe you'll like me better. And like, she kept saying, she was like, and this is the '90s, right? So, I mean, nowadays that probably stuff's kind of frowned upon. But back then, like, she's like, are you gonna ask me out again today? I was like, yeah, maybe. I was thinking about it. But so like,
the fact she entertained it though, yeah, that's
she was. I almost had her. Like, she was thinking about it. But yeah,
man.
actually, my wife, she was involved with someone we met.
Yeah.
Oh, really? Yeah.
Yeah, friend. They were allegedly supposed to get married, and but yeah. So I mean, I have experience with it, and it is emotionally tolling.
Yeah.
I mean, severely. Especially if you're the pursuer person, because like you're just in this limbo world, and then you start to like it starts to become more than just hanging out, but like you're like the outside person, and yeah, I remember those days, and it's just stressful. I mean, if you're gonna like do this, you gotta like have fortitude, because it's not for
the weak.
It's not for the weak, man.
Yeah.
It'll crush you. And honestly, for me, it worked. I mean, my wife and I have been married 25 years, so obviously it can work out. I'm not sure like people should.
I'm gonna tell you like this too. If she do choose her boyfriend, I'm very tender. So then, like, I'll be hurt. Like, my feelings will be so hurt.
I know, man. Like, yeah, and I'll tell you, like, having been in that, it's like it's almost like it could just like end at any point.
Yeah,
because you're like the outside person.
Yeah, you like the outside looking in.
You're on the outside looking in.
Do it.
It's tough, man.
Don't set yourself up, man.
But I do, I do believe though that like I mean, a dating relationship's not marriage, and all is fair in love and war. And look, if you got the stones to go after somebody that's taken, like, more power to you. I mean, it can work out. I mean, it's emotionally tolling, and there are the downsides, but
boyfriend girlfriend versus marriage is
yeah, I think
very
marriage is different, right? Obviously, then you get into like family and kids
Children,
and like just divorce. I mean, no, we're not talking about that. We're talking.
Well, I've been there. So.
Oh, right. We all have like our own experiences, don't we?
Absolutely, 100%.
All right, so I guess I'm the only one. I was really curious what you guys were going to say about
I think
this.
it's a good topic.
It's interesting, right?
Yeah,
I mean, because
topic.
it's kind of a taboo topic, but so yeah, Dr. Hermann says like go for that stuff.
I think some people would be okay with it, for sure.
Yeah, go for it. You never know what's going to happen, right? You could end up being married for 25 years.
I don't think I would like it if a boy that had a girlfriend or like whatever was trying to pursue me. I would think it's like I'd be like, ew.
Well, I would assume that like the person
like,
pursuing is single.
creepy.
Pursuing the person.
I mean.
Oh, it could go either way.
Yeah,
I guess.
exactly.
I guess it could go either way. Yeah, I didn't think about that.
Yeah.
Yeah, that is weird. Yeah, then it becomes more of like they're just playing or whatever. It's not serious. Yeah, I'm talking serious dating. We're not talking like fooling around here. We're talking serious dating. All right, well, that was kind of fun actually. These kind of like off-topic things are good. It was like the one we did about the space aliens. Like really had nothing to do with medicine, but it was one of our funnest topics.
We talked about aliens.
Yeah, well, did we do some alien, like the alien body or something? I can't remember. I'll have to go back.
The little
powdered
alien donut man.
Yeah, right. Yeah, that was hilarious. We're gonna have to do some more of these odd segments. Okay, I think that is all the time we have for today. Please leave us a comment. Let us know what you think about what we talked about today, and let us know if you want us to talk about something else on our next episode of Nip Talk.
Bye.